Hi everybody, welcome to the Becky and Boca Show. I am here in Boca Raton with two of my favorite doctors. They have both done work on me. This is Dr. Arthur Handel, plastic surgery, and this is Dr. Christopher Pittman, vein and lymphatic specialist. Now, the reason I have them both here together is because they are together at Handel Plastic Surgery, and it's very exciting because now you can come here for all of your aesthetic work as well as regular vein work. I had my leg and hand veins done by you at Vein911 in Tampa, Dr. Pittman, and I'm so happy that Vein911 is available right now, 1 day a week in Boca Raton. These are my hands before treatment. Look at those veins. Even for me, it's hard to believe. Now my hand veins are just not a problem anymore. And here's a picture of my leg veins before you treated them. They weren't much better than the hand veins. Again, hard to believe because I don't have this problem anymore. No more achy legs, no more swelling, and no more visible veins. Dr. Handel, how do you feel about having this guy here?
Oh, I'm excited about it, and I've been looking forward to having this type of a relationship with an expert like him because we've always had patients asking us where can we get the proper care for our vein issues, and he's the answer.
He's the best. He really is. And Dr. Pittman, how do you feel about being here? You came over here from Tampa.
It's
a different
long
world.
overdue, and we're thrilled to be here. And thank you, Dr. Handel, for inviting us into your incredible office.
Yes, this is an incredible medical and surgical center located right here in East Boca Raton.
And I've heard a lot about him over the
Right.
years and being the leading plastic surgeon in the Boca Raton area. So we're really thrilled to be here and look forward to a long collaborative relationship.
Both done work on me. I've been extremely happy, and it's so nice that you're going to be available to everybody around here. Now you can come here and get head to toe, everything done.
Literally.
You can, you really can. Dr. Handel, I've done events with you around Boca Raton over the years, and I was your patient for face and neck surgery a little over 5 years ago, and one of the things I love about your work is how natural it looks. I remember you asked me to bring in photos of myself when I was younger, and you used those photos as a guide so that I would look like myself and not like somebody else. I loved that. Okay, Dr. Handel, tell us what you've been up to. I haven't checked in with you in a while.
Well, we've been busy just performing our usual surgeries of the face and breast and body. The exciting thing that we have now is that we're finally realizing the dream that I always had, which was to turn this place into a totally aesthetic location. So we're doing a major renovation of our second floor, and the next phase will be the first floor. To expand the surgery center.
Oh, wow.
And then that's what's so great about having Dr. Pittman here, because over all these years, my goal was to have everybody taking care of all their aesthetic needs. And their veins is one thing.
Very important.
Extremely important, not just from an aesthetic view, but also from a functional view. Myself being a personal patient, because I've had these problems all my life, especially with what I do, standing on my feet all day long. And it's something that is a necessary adjunct to any kind of practice of aesthetic surgery. But over the years, I've had so many patients ask me who can take care of this. And I wasn't an expert in it, and I would never venture into it. And I finally, through your introduction, met Dr. Pittman.
You've got your expert right here.
Yeah, and he's world class.
We brought him in from another city.
And I think he's going to offer great things to all the patients around here wherever he goes, because he has an understanding of the anatomy and the pathophysiology of veins that most people aren't even aware of.
Right.
And that's his passion, and that's what I like, a passionate person, just like we are about plastic surgery, aesthetic plastic surgery. I think he's going to do a knockout job knocking out those veins.
He will.
And we're excited and proud to have him on board with us, and we hope that this continues to even evolve into a more well-known procedure around this area to offer this to anyone who has any kind of needs.
Okay, he did my hand veins and my leg veins. Dr. Pittman. And I think you initially did my leg veins a few years ago.
We did your medical
The
things
medical part.
first and then cosmetic.
Right.
Because when people come to see us, we have to decide, are they medical, cosmetic, or both? And most people are both. And many of them don't know it. Because a lot of people have leg symptoms and they never get the proper diagnosis. Literally millions of unaware Americans suffer from vein disease that they and their physicians don't know they have. It's really that big a problem. About 60 to 80% of us will get medical vein disease before we die. So you can have pretty good looking legs and still be suffering from a significant medical issue. And if you don't deal with the medical, cosmetic often doesn't get better. So it's legendary that, you know, ladies will get their leg veins done for years and years and then it stops working.
They're just doing the surface.
They're just doing the
I
surface.
know from experience you have to treat the root of the problem
Correct.
first. And that is medical and it's usually covered by insurance, correct?
It's always covered by insurance when people have lifestyle limiting symptoms. And many of us have undiagnosed swelling or edema in our ankles.
A lot of people have
So we won the top research award at our annual meeting last October. It has to do with swelling. Literally 3 out of 4 people that walk into our office from age 20 to 100 have detectable swelling or edema in their ankles. So it's literally epidemic in the country. Why? Because vein disease is epidemic in the country, but patients and their physicians don't realize it. And so they suffer for years with all sorts of symptoms that they don't get help with, but they also suffer on the cosmetic side because spider vein sclerotherapy may work for a while, but at some point the medical catches up and you need to start dealing with the medical in order to get the
Right.
cosmetic outcome. So there's not a vein anybody has literally anywhere on the body that we can't get rid of.
And you
We can
use
get rid of it.
foam, which is kind of unusual.
Foam.
I don't want to
Well,
say unusual, but most doctors don't use that.
Yeah, foam sclerotherapy has been around for decades, but we're a recognized world expert on that, and it's the answer to everything in our practice. We've recently trademarked the way that we perform foam as Vein911. And we use foam not only for medical vein disease, but also cosmetic vein disease.
I'm going to show our viewers now what it looked like when you injected my legs. This is some video from the Becky and Boca archives. It's a video of you actually injecting foam into the veins of my legs. I want to point out that it does not hurt at all. That is such a tiny, tiny needle you're using. And then within a few weeks, the veins just kind of disappear.
You can get rid of all of these without surgery, walk in, walk out, no limitations whatsoever.
And let me tell you, I did it and it's it's great. It really is. So, Dr. Handel, you do all aesthetic medicine, including plastic surgery?
We've always done hair transplants as part of
Right.
our practice, but I didn't make it a large part of my practice due to my schedule. And our expansion of our facility will be offering that along with all our full line of radio frequency devices from InMode, which is the Evolve, which is a skin tightening and fat melting machine. It also has muscle tightening and muscle building properties to it. Also the Face Tight, Body Tight, and Votiva, which is the vaginal rejuvenation and restoration device, which works. It works with urinary incontinence,
Oh, that's big.
vaginal dryness. It helps patients who have been on chemotherapy or just the normal aging process or hormonal issues. And everyone we've used it on is very happy.
Wow.
So we just have to get the word out there about these procedures.
All the things that you have available.
And then once we have this whole facility designed and implemented the way our dream is, you know, I think it'll be great. And I'm really excited about having Dr. Pittman bring his fabulous techniques
wonderful.
here. And just, you know, we want to take care of our patients. We want
Yeah.
to make this a one-stop place where people can come and know they're getting the right thing done.
Right.
Whether it's fillers to surgery to veins and the latest technology that works. We don't want something that's not going to work. And that's what we've tried to build our reputation on over the years. And we're excited to have them on board, and I think we're going to make a lot of people very happy.
2 quality doctors right here, let me tell you. You guys do great work. Okay, everybody, thanks for joining me on this episode of the Becky and Boca Show as I brought you to Handle Plastic Surgery in East Boca Raton. Dr. Arthur Handel, and we've got Dr. Christopher Pittman. Bye-bye.